Reflux, or more properly, vesicoureteral reflux, refers to urine washing backwards from the bladder back up to the kidney. So the expectation is that urine travels down the kidney, down the ureter, or down from the kidney, down the ureter, and then into the bladder. There's a valve-like mechanism where the ureter enters into the bladder, and that's supposed to be a one-way valve, so that once urine goes from the ureter into the bladder, it stays essentially trapped there until it's evacuated from the bladder by urination. Reflux, that valve is faulty, and so that allows for urine to wash back up to the kidney. That can be problematic because if there's a bacteria present in the bladder, then reflux allows for that bacteria to be delivered back up to the kidney, and that's a real setup for developing a urinary tract infection that's not just a bladder infection, but a kidney infection. Kidney infections run the risk of causing scarring to the kidneys. At best, kidney infection or pyelonephritis will cause fever, poor energy, poor appetite, flank pain, and significant illness. But the sequelae of that, the result of that, is that scarring can occur. Problem with scarring in the kidney is the kidney doesn't have any real regenerative capacity. It can't fix itself. It can't heal itself so that tissue that is lost is replaced again. And so a loss of kidney tissue from scarring is a loss of kidney tissue that's permanent. And that's why pediatric urologists have been so interested in reflux, understanding which patient is at risk and understanding what the best treatment is in order to eliminate that risk, not just so they don't get kidney infections, but they also are at a lower risk for getting kidney scarring.